Hey everyone, welcome back to The Broken Brain. It's me, Dwight, here to talk with you about everything to do with psychology, culture, and eating. That's right, talking about eating today, one of my favorite things. This is actually a replay of an interview that I did about 2.5, 3 years ago with Dr. Chris Aiken, who is a specialist in the area of dietary and eating habits to help with bipolar disorder and other mood disorders. We're in the beginning of the year here. A lot of people think about their health habits, dietary habits, and emotional and psychological management is definitely a good reason to be focused on that. If you hop over to Twitter at Break-A-Brain, I would like to hear a couple of suggestions from you on topics that you'd like to hear coming up in the new year. Culture, pop culture, mental health treatment, addiction, trauma, things we talk a lot about on the show. And I'd just love to hear from you that way. I'd like to start a Broken Brain book club. One of the ways to start that would be to tweet at me. Let me know if there's a book that you would like to start with. We've had lots of authors and creators of material come on the show. We might be picking from that or a listener submission, thing like that. So one quick little plug for our Patreon. It's patreon.com/brokenbrain. There's a lot of bonus materials dropping there. I try to have something there every week. I'd say about 3 out of every 4 weeks of the month. Did that make sense? About 3 weeks out of the month, there's something that's there. You can see video of the interviews that show up here in your podcast feed. Those go up pretty much right after we do them. I do a regular Patreon show with Chris Revel, frequent guest here, and the host and creator of the Let's Chat, and just various things. I'm just recording later today a review of a couple articles from the latest issue of Psychology Today, just for you patrons. So that's kind of some stuff doing for fun. And speaking of fun, I want to do a prize giveaway. You can get a copy of You Next, Reflections in Black Barbershops by Antonio N. Johnson. Antonio Johnson came on the show a while back to talk about this. It's a series of photo essays and stunningly beautiful black and white photography of the phenomenon in the U.S. of black barbershops and the role that they play in the African-American community. So here's how you win. If you are the first one to identify who is that in the banner photo of my Twitter, at Break-A-Brain on Twitter, if you can identify the banner photo, tell me who that is, and I'll give you one clue. It is not Wolverine. It looks like some kind of old-timey alternate reality Marvel version of Wolverine in a way. But if you can identify who it is, then I'll send it to you. As always, thanks for listening. It's fun to make these things and put them out there for you. It's fun to be connected with all of you that are listening and that make this show possible. All right, Chris, thanks for being here. Man, this is really exciting. Reading what you've been doing with your research and things. As we were just saying, as we're setting up to record, this is something that I think is really important for people. I find a lot of interest in it personally as a clinician. I also have been diagnosed with bipolar disorder. I'm always interested to know the things that I should be doing to manage my mental health. Then I can decide whether or not how often to do them, but it's always good to know what you ought to be doing.
Yes, there'll be a lot of oughts to today. And this is a field that I entered into skeptically. I really didn't believe that food would affect the brain so much because there's something called a blood-brain barrier, and that's supposed to keep everything out of the brain. So it makes sense to think of the brain as free from all those toxins that we're eating, but through various mechanisms that surprised me, it's really not.
Yeah, it seems like there's a lot of talk about gut health and things like that nowadays. And I'm sure you'll talk about that. It's interesting to hear because whenever something like that happens, I think there's a lot of attention paid to different dietary things. And I'm really excited to hear from a real medical perspective, real medical professional about how some of that works.
Yeah, so we can start there with the gut. That's where a lot of the action is this idea that you have a huge number of probiotics, your microbiome, your gut bacteria in your gut. And these little animals can influence you in various ways. You can have a healthy flora or an unhealthy flora. I find this hard to believe, but this is what the science shows, that if you eat unhealthy food, like fast food, the bacteria grow that like that food. And then they send messages to your brain that make you want to eat more of that food. So that's just one example of how these little critters are affecting our behavior. They're doing other things. So they can send inflammatory messages. They can raise or lower your brain-derived neurotrophic factor, which impacts brain growth. They can alter your metabolism. They can cause something called leaky gut, which is where the barrier that keeps all of that, well, literally crappy stuff from getting into your bloodstream breaks down a bit and stuff is leaking through. It sounds awful, and it is awful, and it causes inflammation.
Just the name.
So if we just start with the gut,
Yeah.
it's not just about what you eat, but about what your fellow passengers who are in there like you to eat. And so the other side, if you eat healthier foods, the bacteria grow that like the healthier foods, and they make you less depressed, make you want to eat more healthier foods.
So it sounds to me like you're thinking the phrase little passengers isn't quite as terrifying as the phrase leaky gut, but it sounds like a useful concept, though. Whatever you're feeding them is what they want to eat.
Yeah, it kind of makes sense when you think about it. They are there and they want what they want, like your cat who's bugging you for whatever your cat wants and making you behave a certain way to give it to her.
You mentioned that this was something that's hard for you naturally to approach or believe, but the science bears it out. Were you always involved in nutritional types of medicine, or what kind of is your background there?
No, I was a fairly unhealthy eater, and I respected the effects of diet on the body, but really I thought the brain was different. I wrote a book a couple years ago on the lifestyle approaches to bipolar, and at that point, we knew enough about how food affects the brain that I knew something was going on. And I'd also seen patients get changed. So I put a chapter in it there, and I just laid out a diet that looked like it would be good for the brain. But at the time, I recommended in the book, and this is one thing I'd change in it, that if people want to get a big result in their depression, they ought to do exercise instead of diet. I didn't have any evidence that diet would really make a big difference. So about a year after the book came out, somebody took the same diet, gave it to patients. Half of them got the diet. Half of them just got regular supportive counseling. They called it befriending therapy, which is like just sitting and talking like a friend. I mean, that's got to be good for depression. So the bottom line is that the half who got the dietary advice, they had a huge effect on their depression, bigger than the effect size we see with antidepressants. So now I'm changing that. I'm saying you can exercise or you can go to this Mediterranean style diet. Whichever one, you're going to see a big effect in your mental health. And I think that's what I'm seeing in my patients.
We had some questions from people online. I put it out that I was going to be talking to you. And that one of the questions that did come up was reactions with medication. For those that are taking medication, either adverse or good kind of results that people could think about when they're taking medication.
I think you mean like interactions, like drug interactions with medications, perhaps, and
Yes,
possibly
yes.
good ones too.
Yeah, adverse
Definitely
or
definitely so.
non-adverse. That's not the way to say that, but
Definitely so. So there's only one main medication that has dietary guidelines, and that's the MAOI antidepressant. These are very powerful antidepressants. So I won't get into that. They have a specific guideline to prevent dangerous high blood pressure. Outside of that, if you take psychiatric medications, you don't need to worry about drug interactions with food. But I like what you said otherwise, is that the foods might help the medicines work better in some ways. And the main ones I think of there are called the atypical antipsychotics, like Zyprexa, Seroquel, Abilify, Latuda. And these drugs do a lot of good. They help depression, and particularly bipolar depression. But they do this thing we don't like, is they change your gut metabolism, making you more at risk for metabolic problems like hypertension, high cholesterol, and diabetes, weight gain. So pairing this diet with one of those medicines, I think, would be critical.
So they actually can enhance not just the effects of the medication, you're talking about sort of also compensating for side effects that are potential to your health.
Exactly. And when you consider that those side effects have negative effects on the brain, obesity, then you're doing yourself a lot of good mentally. And that's an important point, that there's very few medicines that are all 100% good for your brain, even. So not just physical side effects, but think about that. You probably don't have many friends that are 100% perfect or good. Everybody's a little good and bad. And medicines are the same way, and they befuddle me because I look at a medicine like Seroquel, quetiapine, and I see it has 12 black box warnings and it causes weight gain and diabetes. And I'm thinking, this can't be good for you. But then when they look at the research, people who take that one live about 8 years longer than if you don't treat the bipolar. Mm-hmm. So I do want listeners to know that even if they see a lot of things, it's not like they're feeling better and are going to die because of it. They're going to cut their life short. No, nothing is better for you than having your brain work well. When your brain works well, your body works well. But yes, there are some side effects that you can reverse with diet that way, and that would be one of them.
Well, that's very intriguing. Yeah, I always like to talk about this in therapy, that we don't really make decisions based off of pros and cons only. What we really do is look at situations to see which groups of pros and cons we really would prefer, right? Ideally.
That's right.
And
yes, it's not black and white.
Because we're talking about alternate methods of managing bipolar disorder and mood disorders. We're not saying don't take medication, and obviously you're not saying that.
That's right. For non-bipolar depression, it would be possible. They estimate that about 30% of people could get better by rigorous diet and exercise. So without bipolar, there could be some hope for some patients, and that'd be definitely a first step. If I had depression, I would start there.
Yeah, and there is always that, we talked about this on a previous episode, where there's that 30% or so, maybe 40% who just don't get the benefit from medication as much, particularly with depression.
Yes, exactly.
Yeah.
And so let's look at that 30%, because what people are starting to talk about as a possible cause is called inflammation. And normally we think about causes of depression and bipolar as being in the brain. What's unique here, it's the first time scientists are saying maybe it's in the body. And they're estimating that about 30% exactly of people with depression, whether bipolar or regular, that it's caused by inflammation in the body. And that this is even higher if you look at people who don't respond to antidepressants. So I think you're definitely onto something, that if antidepressants are not working for you, you'd want to take a look at your physical health and make sure, normally 10 years ago, we would have just told people, make sure you don't have low thyroid or something. But now I think the message needs to be make sure that you're exercising and eating healthy and getting sunlight in the morning as well.
And those are some of the ways you'd address that. As far as assessing that inflammation, how do we tell if we're in that percentage?
Well, there's a number of signs. The medical one that's starting to come out is called the C-reactive protein, CRP. And it's a $50 blood test that's normally used to measure risk of heart disease. But there's about 4 or 5 studies out showing that if you have a high C-reactive protein, you might respond better to an antidepressant that involves dopamine or norepinephrine. For example, the tricyclics, Wellbutrin. In the bipolar category, they found Latuda worked well. And they're thinking of medicine called Mirapex, which affects dopamine, can work well. But we also know that if you have that high C-reactive protein, you'd do better with the diet and exercise approach. Other signs of inflammation besides the lab are stress, obesity, inactivity, chronic medical illness, and the Western diet.
Let's dig into that a little bit.
The diet I put forth in my book is pretty identical to what they studied in Australia. And that's just because we were all pulling from the same resources. So in Australia, they put together a diet that is relatively easy to follow, but has a lot of brain benefits. And that's what they tested. And that's what I use now. I use their version. And what it is they basically adopted it from the Mediterranean diet. That's the one that we consistently know is the best for the body overall. And part of their thinking there is that what's good for the body, what's good particularly for the heart, is going to be good for the brain. Now, let me get to that. Taking care of your heart health and your blood pressure, so a diet with less salt and less fried fatty foods, is going to help the blood flow better and less pounding hypertension. Imagine that force on your brain day after day. That is being shown to be linked to depression and poor cognitive function. So they're onto something there. In a way, you could just call it a good diet for blood pressure. But they also threw in some brain superfoods that we knew from other research help brain cells to grow and protect them. Things like dark green vegetables, so spinach, kale, broccoli, and berries, particularly blueberries, and colorful fruits. All of these have something called flavanols, which same ingredient wine, which is why people think red wine is so good for you, which it is kind of good and bad, and dark chocolate, tea. So flavanols directly protect brain cells and improve memory. They're often used in age-related memory loss. They help that as well.
I had heard that about blueberries, that they encourage that as a way to fight age-related brain disorders.
And I'm going to comment on that is I got so excited about these things, these brain superfoods like blueberries, that I was telling all my patients to just eat a lot of blueberries. And when I visited the nutritionist in Australia, they taught me that it's not really about finding the great food, but the variety. And this is where food is very different from medicine. You'd never want your doctor to say, I got a whole lot of meds and each one does a little good, so why don't you take one of each? You'd want your doctor to say, this is the best med for you. So in food, it's the most variety, because the idea here is that your brain needs all these colors, the colors in the vegetables and the fruits. Each of those are different phytochemicals or plant chemicals. They're going to do something different for your brain. It's a lot like a multivitamin. You'd rather have a multivitamin with 50 vitamins in it than 10. So variety is really good here. And that also gets us out of the notion that there are bad foods and good foods, because chicken is going to do some good. A little bit of steak is going to do some good. They have found that people who are pure vegetarians have greater risk for depression. They might be missing some B12 or iron.
So a lot of that influences the way we plan. Like basically, I'm thinking about the trip to the grocery store as you're talking about that. And and for some of us, we thrive on the regular list of like, here's the 5 things I should get. You're talking about also for those that don't think in that organized grocery list way, that there's still that I'm grabbing from a greater list of things.
Yes, shaking it up with variety as you go to the store. Although in the beginning, it is easier for people to just find the healthy foods they like and start with those. And that was a challenge for me. So I actually went on this diet when I was doing the research. And like I said, I'd never eaten healthy in my life. I'd never been on a diet. And now I'm really upset because I can't get off it. Like if I go have a Chick-fil-A sandwich, I feel miserable all day. I feel slowed down and awful and stomach is bursting. So right now I continue on the diet, although it started as an experiment, just because I can't tolerate the other foods. And I'll get to that because I want to say that the diet can go in 2 directions. One is to eat more of the good stuff. The other is eat less of the bad stuff. The end result is going to be the same. You're going to get benefit either way. So let me start with the bad stuff. A few foods where it's very hard to find anything good about them. And I'll list them now. Fried foods, fast foods, processed foods, sugary sweets and white breads. That's about it. So desserts, sugary sweets, that includes sodas. Now, the most confusing one of those is processed foods, because what does that mean? Like canned tomatoes and bread, sliced bread is technically processed, but I would put that as just highly processed foods. And that's not very well defined, even that, but here we're talking about things that are packaged, pre-made, and have at least 2 or 3 chemical ingredients on the label. That's about the best measure I can find for what is a processed food.
No, that's good. I think that one of the issues with trying to avoid processed food is living in a world in which all of our food is processed to some degree. And going out and harvesting our own food in our own backyards and hunting our own meat is not tenable, of course, for day-to-day living. And so I like that definition. That's very helpful.
Yes, and that does include deli meats, bacon, sausage. Those are pre-made as well. So on those, I'll call them the bad foods, you can have 3 servings a week of those. That's allowed in the diet. So actually in the diet, no single food is excluded. You can have a little bit of those. Now, why is that? Why do we allow 3 a week? Because the way I look at it, your body has so many built-in processes that are going to clean it out. And if you give it some time, it'll clean it out. But imagine you have a cleaning service in your house and you got a whole lot of kids who are wrecking havoc in it. They're not going to be able to keep it clean. But if you only have a child visit once a week and there's just a little bit of a mess, your cleaning service can keep up with it. So basically, you want your body's cleaning service to keep up with whatever you're putting in there.
Keeping the children out of the house is a pretty good cleaning strategy.
Yes, exactly.
No, that makes sense. And is that a reflection of kind of the natural process? Because some of those foods, not the highly processed foods, but some of those foods you would encounter somewhat in the natural world. I mean, high sugars, but not very frequently.
That's exactly right. So there's nothing bad about them at all. Just the frequency that we eat them. Now, I'll move on to just describe the diet. Then there's the foods that you can eat in moderation. And the moderation is not that extreme. Like to start with eggs, you can have 6 eggs a week on the diet. And then dairy, which includes milk, cheese, and yogurt, 3 servings a day. Chicken and poultry, 2 to 3 a week. And red meat, 3 to 4 servings a week of lean red meat. So that's really not depriving people too much of those. And the reason we actually want people to eat those in moderation, because all of those have some good in them. The problem is if you eat too much of it, it starts to clog your blood vessels, and that's not good. Next are the foods that are almost entirely good. They do give in the recommended servings certain amounts, but from my point of view, just eat as much of it as you. These do mostly good to your brain and your body when you eat them. All right, now I'm going to list the stuff that's all good. Vegetables, fruits, and you want to get the whole fruit because the fruit juice is just sugar. Mm-hmm. But the fruits and vegetables, they can be fresh or frozen, canned, doesn't matter. Nuts, seeds, and olives. That includes hummus, fish, beans, and extra virgin olive oil. In this diet, they're asking you to switch all of your butter and oil to extra virgin olive oil. And the reason is that the extra virgin has extra stuff that is antioxidants and vitamins that help protect your brain. They're actually good for you and good for your metabolism. And you can actually cook with extra virgin olive oil. I've made the switch, so I put eggs in it. I even make popcorn in it. There's a myth out there that you can't cook at high heats with it, but actually it's been studied and you can cook up to, I think, 450 degrees with extra virgin olive oil. Now, the most complicated of these categories is the whole grains. That one took me a while to learn because there's so many things in the grocery store that are trying to sound like whole grains that are not. And the whole grains is a good category. So here's a myth to understand. Carbs and bread are good for you if they're 100% whole grains. And it's the same reason why fruit is good for you, but fruit juice is not. Because fruit is like the whole fruit. It has this extra fiber and stuff in it. So whole grains, it has the grain with the extra fiber and the protein and the vitamins and the coating. Okay, so a couple myths. This is not just brown bread, because the brown is just the color. That can be refined grains. It's not multigrain, and it's not made with whole grains. That's the biggest myth. That just means they sprinkled a few in on top. Mm-hmm. That's not going to do you much good. So you want to get 100% whole grains. You can look for the yellow whole grain stamp, or look for the word 100%, or look on the ingredients and see that all of the grains are called whole.
So it doesn't have to be the big chunky bread that you buy that's got sesame seeds in it and stuff.
No. Oh, in truth, it often is. It often is brown. That's true. There is somewhere a white whole grain that I've not been able to find. But you can find some whole grains that you'll probably like. They make pancakes, crackers, cereals like Mueslix are whole grain. And of course, oatmeal is a whole grain. And my favorite whole grain is popcorn. So popcorn made at home with extra virgin olive oil, a little bit of salt, is not only allowed, encouraged on this diet.
That's interesting. What about homemade bread? Is it something people can somewhat gather the ingredients?
It's going to be much better overall because it's not going to be processed. And like I said, sliced bread has a little bit of processing to keep it preserved on the shelf. So anything you do homemade, you can cut yourself some slack, but you can also control the ingredients and try to go for the extra virgin olive oil instead of the butter. When you mix it all together, try to choose whole grains as well. And if you're really savvy, you might find that magical white whole grain out there.
The one you're still
But there are
searching
many whole
for.
grains, so you can choose your favorites on that level. Anything can be a whole grain. It just means the original form. So pumpernickel bread, it's black. It's not a whole grain. It's usually refined pumpernickel. So don't think you need to go for that. Just go for whole grain breads that you like.
Some of this goes back to the way we make food and as a culture, which is made for the masses. And so they want it to stay good as long. And there's also the influence of wanting to sell, right? So it's sweeter and fattier foods sell better because their body wants them.
That's exactly right. And one thing you brought up to me earlier is this new research on sugar and bipolar. So although we now have 3 controlled studies of this diet showing it treats depression, none of those were done in bipolar disorder. But from what we know about the biology, we know that it would work in bipolar. That is, it's neuroprotective. It protects brain cells. It improves metabolism, so your metabolic hormones are flowing more regular and more stable. That's a big part of the recovery in bipolar, is that circadian rhythm getting stable. And it's anti-inflammatory, giving your brain the vitamins that it needs to make those neurochemicals, like folate. Some of our listeners might be taking folate to make their antidepressants work better. Common tactic. There's a prescription version called Deplin or methylfolate that's often used. So this is just giving them that in food form. But back to bipolar. So what do we know about bipolar? I would just say that this does work for bipolar. From what we know, it's not been tested yet in people that much, but from all the science we have, it should work. What we have found in bipolar is something surprising, that high fructose corn syrup can cause manic symptoms. Now, that's a type of synthetic sugar, basically. So
and it's only luckily it's only in all of the food that we purchase and eat.
I know. So why is there so much bipolar out there, right? The other finding was increasing admissions for mania in the hospital. And that was an interesting one because they narrowed it down to the nitrates in beef jerky. So when they saw this rise in beef jerky admissions, people eating beef jerky getting admitted, they didn't know what that was. So they gave various isolates of the beef jerky to mice, and then they figured out which part of it was making the mice manic. They even looked at those mouse brains and saw bipolar-like changes in the brain with the nitrates. So we're talking nitrated meats, beef jerky, pepperoni, possibly bacon. The study really just isolated beef jerky, but these other prosciutto, these might be implicated as well.
Yeah, that's why I was happy to hear you say that a certain amount of those servings are allowed. Those are some of my favorite foods. Are the bruschetta or bruschetta?
Yes, I don't remember
meats like that.
Was implicated. There were a few that were not. I can look that up. But we really only know about beef jerky being a problem. The rest is mostly speculative. But those other meats are processed and really aren't good for you anyway. So you want to use them, and I'm talking about the dried sausages, the pepperonis, and all the wonderful deli meats, the Italian sub sandwiches. You want to use them as like a topping, like the way you'd use mayonnaise or mustard, like just a small amount, and try to buy some that have a lot of really good flavor in them, and then you don't need as much. Mm-hmm. Same thing with cheese. The real super flavored cheese, you don't need quite as much.
What results in people's health and mental health management did you start to see that made you come around to this kind of thinking?
You mean results in patients that I see?
Yes.
Okay. Let me check something first.
Sure thing.
Oh, interesting. That's very cool. Yes. I'm going to correct something. Mm-hmm. Prosciutto is dry cured without nitrates, so you don't have to worry about that one at all. Very good.
Good to hear.
All right. So what are we seeing in people? Well, I said that this diet is mostly linked to inflammation, is a big part of how it works. It's anti-inflammatory. So let me tell you what inflammation does to the brain and how that looks in people. Basically rips away at the dopamine center. And what that looks like, we call it anhedonia, is people who just get no pleasure out of anything. It's that particular symptom of depression. Now you can understand then how someone who doesn't get pleasure might turn to sweets to try to get some fix. That makes sense. And memory. So a lot of this is anti-inflammatory around the memory center. So we're basically seeing, well, let me back up and just put it like this. When my patients go on this diet and come back and pair it with exercise in particular, I often don't recognize them when they come back. Now, that's true for anyone who recovers from depression, because depression affects all of your muscles, makes you look slowed down and your facial muscles are stiff or slagging. So you come back, your face is going to look different. But here they come back, and not only that, but they have more energy, they've lost weight, their muscles are firmer, and their skin is glowing more with the inflammation down. So I just sit there and listen to them, and it's a real experience to see such a change in someone physically and mentally. I don't tend to see that fuller whole body change as much with medication. So back to your question, we're helping people with their motivation and drive and ability to experience pleasure and their concentration and memory.
And that's a big one. I know that anhedonic response where they lose pleasure, or it makes people have a difficult time also with therapeutic interventions or things that you can do to try to fight against depressive episodes are more difficult to do when you have a loss of energy and a loss of pleasure. I think people think of it as just, I don't like my hobbies anymore, and that's a big deal, or I don't like and enjoy the things that I do for fun. But it really, really ties into the system of recovery too, because without an appropriate sense of pleasure, then it's hard for me to engage in healthy choices.
Yes, and it also points you as a therapist into what to look at and where to go. If someone has anhedonia, then look at their behaviors day to day. Look at how they're living each day. They might be doing very little activity, and that would be a great way to intervene.
I wanted to ask about some of the psychological and lifestyle obstacles to turning a corner on something like this. It's a big change. Anytime people talk about eating, and I believe that's why most diets that are designed for weight loss don't persist. The results don't last very long term many times because people go back to what they usually do. It's a struggle in addiction management. It's a struggle in all kinds of things. What kinds of thoughts do you have about overcoming some of those behavioral or psychological obstacles to changing one's lifestyle like this?
Starting with something that's easy for you to do, which means foods that you like. So that might be your favorite fruit. For me, it was watermelon. Or your favorite vegetable, which I didn't have, but I tried. And popcorn made at home, not the microwave type. Whole grains. I learned to love whole grains. They're very tasty, dipping them in olive oil. And oatmeal, whatever it is that you like, start with that and build from there. Because as you add things in, your mood is going to get better and better, and you'll be able to do more and more, and you also will see the benefit of it.
And those of us with any kind of mood disorder, but particularly cyclical mood disorders, we are pretty notorious for black and white thinking. So I think that's very good feedback to say start where you can. And the idea that you benefit from anything that you are changing, I think is very powerful. Instead of because a lot of us tend to go, oh, I'm not doing it right, and then we give up.
Yes, very good point. Very good. A couple other things about maintaining the diet. They studied this very same diet compared to calorie counting for weight loss. Now, let me clarify. In this diet, there is absolutely no calorie restrictions. You can eat as much as you want. Just eat more of the good stuff. And this diet led to more sustained weight loss than calorie counting. So it's easier for people to maintain. And you got to ask yourself, why is this diet causing weight loss if there's no calorie restriction? I think the reason is that the diet is changing your metabolic hormones. So you can look on these foods as diet medicines. Imagine that. If everybody wants a diet pill, well, a carrot or broccoli or blueberries might be a diet in positive ways. And I don't know if you'll ask about this, but I would like to present some new research and give everyone strange permission on two things.
Yes.
So maybe as you wrap up, you might slice these in, is that I think people need to know that artificial sweeteners, diet sodas, are medicine. Those artificial sweeteners should be classified and looked upon just like any medicine the doctor gives you. They're a medicine that makes things sweet. But when a doctor gives you medicine, you worry, what is this going to do to my health? Is it going to cause weight gain? Well, we know that medicines have no calories, but they cause weight gain. So yes, artificial sweeteners have 0 calories, but they cause weight gain.
And I've heard people say that, and they always wonder why that is.
Right. The reason artificial sugars cause weight gain is exactly the same reason that a Western diet causes weight gain, or this antidepressant diet, this Mediterranean diet causes weight loss, is because they're affecting the gut flora. So the artificial sweeteners are giving you bad bacteria in your gut that make you gain weight. And they're increasing your appetite, giving you hunger surges later on. And they're changing your metabolism. So they're doing everything that a bad medicine would do with a little bit of sweetness and 0 calories. Now, here's why I'll tell my patients, if you're going to go that route, just go for the full sugar, because they do have a study showing people depression over time than drinking the artificial sweeteners.
Hang on.
And we have found that the artificial sweeteners...
Sorry, we had another Skype break, right? When you said go for the full sugar.
Repeat that again?
Yeah, right after you said, I tell them to go for the full sugar, there was a little break there.
So I will tell my patients with mood disorders, if they're going to drink sugar, go for the full sugar, because we have direct clinical evidence that artificial sweeteners cause more depression than regular sugar. And we know that artificial sweeteners are causing a little problem in the hippocampus, the memory center, so they're doing something bad for the brain. They are basically bad medicine, and I'd stay away from them. But that gives people permission to drink the regular sodas if they prefer. The other place where this research is giving us good permission is with dark chocolate. So finally, about a month ago, let out the first study that dark chocolate treats depression. I've always suspected it would, because it has a lot of those flavonols we talked about we find in berries. In a lot of studies of older individuals, dark chocolate lowers blood pressure and helps memory. So it made sense to me, and I was glad to see that they turned that light on depression and found that dark chocolate, not milk chocolate, but dark chocolate, reduced the risk of depression. So it wasn't just that people were having a good time eating chocolate, because milk chocolate is just as good. And it's got to be 70%. Now, I'd recommend if people take up the dark chocolate, do no more than 1 ounce a day or so. Keep it like that. Treat it like medicine, because it does have a lot of other sugar and stuff in it too.
So you're not saying as much sugary soda and as much dark chocolate as you can cram in there. Actually, more sparingly for the soda, of course, and as much dark chocolate as you want. That's what I heard. Yeah.
Right. So if you want, not exactly, but the only drink type thing I could find that more is better is tea. So unsweetened tea, they found reduction in depression risk with 3 cups a day. And then if you bring it to 6 cups a day, you get double the reduction in depression risk. So up to 6 cups a day of tea, you're doing more and more good for your brain there.
It's always unsweetened stuff, though.
That is so true. That is so true. So if someone wants to switch to that, they should keep the sweetener in there and just slowly lower it down.
Ah, there you go.
Now, another tip on doing this is a lot of my patients tell me, I don't know where this comes from, but they tell me that they've read that sugar is more addictive than cocaine. I'm sure it comes from some mouse that preferred sugar over cocaine. But a lot of people afraid to get off sugar because they think I'm going to go into all these withdrawals and it's going to be terrible, and how will they conquer this addiction. I would not tell people that sugar is an addiction. That's too intimidating. And in my experience with it, it's not very addictive. There are cravings, but most of my patients, the cravings for sugar go away after they've stopped sugar for 2 weeks. And people tell me that if they've just cut sugar for 2 weeks, they feel greater mental clarity, their senses are more in tune, so music sounds better, they can hear and see things better. It's a remarkable difference.
I kind of wonder if that's up there when I've heard people say the same thing about comparing cocaine or heroin to cigarettes and saying, well, cigarettes are more addictive than those things. And I don't know the medical, chemical breakdown on that. My observation is that one of the things that's more habit forming about certain things is that they are legal and they are available. And in the case of sugar, even encouraged by its presence. And so that might be one of the things that makes it feel so habitual or addictive, is that it's easy to get and it's hard to avoid.
Very true. And there's many ways to measure addiction, from withdrawal problems to euphoric highs to brain changes. So I think what you're seeing there with nicotine and sugar is just people looking at one single measure and not the whole picture.
Yeah. Well, this has been very helpful. I think it's going to help a lot of people, as I put it, to know what they should do, but hopefully also to start doing it. That's the main thing. I find I don't see as many benefits from things unless I do them. That's another flaw in the human system. I wish we could overcome that. And just knowing would be enough.
Well, I agree. And my patients who've done it, I'll tell a story of one woman. Here's a woman with bipolar, and she had a high depression rating for years and years, and many med changes, many therapies. Nothing changed it. And she went on this diet, and just like the research would predict, her depression dropped 30% on it, and it stayed there for 2 years now. And she doesn't follow it religiously. She slipped some, and she certainly keeps up with the sweets now and then, and fried foods and fast foods a couple times a week. Just like I said, it's allowed. That's pretty impressive. She was able to do this. And that's one thing that struck me. Even if you don't believe the diet works, you got to think it's remarkable that they were able to get people with severe depression to follow it, to follow any diet. They could actually do it.
Well, thank you for being here today to share this. Tell people a little bit more where they can find your work. I know that you are on the podcast regularly, and you've written some, and tell people where they find those things.
Yeah, so most of my work is committed to helping people with bipolar get fuller recovery through lifestyle and natural approaches. So the reason I do that is my clinic is full of bipolar, and the medications tend to only get people half better, but they really can get better another 30% with each lifestyle change. And I've written a book on it with Jim Phelps called Bipolar Not So Much. The first half of the book is all about bipolar. The second half is all about the lifestyle approaches. And then for those who are interested in more psychiatric updates, I edit a psych journal called the Carlat Report, and we do a weekly podcast on the latest psych research. And then the name? Bipolar Not So Much book is available from Norton, and I'm coming out with a new one next year that's going to be all lifestyle approaches, much more comprehensive and thorough.
Is that the best place for people to get the book? I always like to ask if there's a best place for them to purchase it from for the author.
Yes, Amazon or the Norton Books website, either one.
Okay. And the name of your show that you're on?
It's called the Carlat Psychiatry Podcast, Carlat.
Great. Really grateful to Dr. Aiken for coming on today to talk about these things. If any of you out there have anything interesting about mental health or psychological research, or really anything at all that you're breaking your brain around, then please reach out. Hit me up on the Twitters at BreakABrain. That's at BreakABrain, except one word, because that's how Twitter works, guys. I'll be back at you again soon with some more fascinating information about the psychological brain stuff of broken. Yeah, next episode. I'll be here. So thanks, and we'll see you then.
Thank you for listening to the Courtemp Arts Podcast Network. To listen to more Courtemp Arts shows, visit courtemparts.com.
I don't chase, I attract. What belongs to me will simply find me.